Hi guys, welcome to my channel Liza Proactive Mom. Today we are jumping on a call with a licensed pediatric occupational therapist who is also core MNRI specialist. Her name is Anastasia Boikova. She helped so many kids overcome their difficulties and equipped parents with knowledge for years to come. I want to ask her all about the approach, how she works with kids, who is a good candidate for the program, and why the earliest intervention is so powerful. Hi Anastasia, thank you for joining me today. It's been a real pleasure to have you as my son's therapist for a couple of months. He enjoyed, I enjoyed, and learned so much from you. And today I want to share this knowledge with other parents who might be lost or they don't know where to start and how to help their premature babies and kids with developmental delays. As I know, you started your career in pediatric ward as an occupational therapist, and then something happened that you decided to acquire a new set of skills and become an MNRI specialist. Can you please share with us what happened and why you decided to go for it?
Thank you so much for this beautiful greeting. I graduated school in 2014 with my master's in occupational therapy, and I was working with children from 0 to almost adults. And I was using traditional method of occupational therapy. And in traditional therapy, we set the goals, and then we work toward the goal, mainly with play therapy, doing puzzles, doing visual worksheets. But there was some missing link that I was trying to find because the progress was not as fast as I was looking for. And I was trying to do my best and deliver the results and help the child. So one of my clients, she was a 7-year-old girl with auditory processing issues. Her mom said, Anastasia, we're going to take a break for 1 month and we're going to go for this program and we're going to come back to you. And I was working with this 7-year-old girl on biking. She couldn't do biking. She couldn't incorporate her both sides of the body. She couldn't climb ladder with the cross-lateral pattern, so to say. Many things were difficult for her. She was not able to focus in school. Her academics were so low. And all I learned in school, I was doing with her, everything that I knew from my master program. And then she coming back in 1 month, and all of a sudden she's biking, her reading, her focus, memory, math skills went up. And I asked Mom, what did she do? I spent half of the year of doing my work. In 1 month, you're coming back with the results that I couldn't deliver. So then she shared with me this beautiful method, MNRI method, and a reflex integration. So when it came into my life, I said, wow, this is the gift, the key for the development, and I need to learn it.
Can you please elaborate about reflexes? I heard so many things and I saw so many researches and articles about primitive reflexes. What are those? I know that MNRI program, MNRI method are based on those primitive reflexes. Can you explain them in simple words for parents?
So reflex is an automatic response of our nervous system to a specific stimulus. And it's given to us for survival and protection by nature. So when the baby is born, those reflexes emerge and they are active. For example, we can say hand supporting reflex, which is if baby is falling, automatically baby is gonna extend arms and protect from falling or protect from any injury. So that's a hands supporting. That's gonna happen automatically. Or there's many other reflexes that are automatic response of our body. So with time, with the development, they start integrating into more complicated movements, and then they become integrated. So they never disappear. They are inside of our body, but they are no longer active, so to say. So usually a child is born with reflexes, they emerge, and then by 1 year of age, they are no longer active. That should happen that way.
So sometimes there are cases that those reflexes are still active, they're still alive, right? In child, that it's not supposed to be this way, and that's the root of the delays and some troubles and struggles and poor academic performance, or something else.
Correct. So yes, during certain events that occur in our life, a child or even adult, even us adults, we may experience trauma or such a stressful event that those primary reflexes will step out, so to say, out of the nervous system as a protection, as a survival. So for children, for babies, if we're going to talk, there is many reasons. They can be environmental, maternal, can be birth process, can be congenital disorders, can be trauma during birth, can be chronic or like even intermittent but very severe stress, can be any disease, a non-congenital disease. So what happens, all this can cause a blocked or damaged neural pathway that is necessary for the reflex to occur. So when this blockage, so to say, or damage happened to the pathway for the brain, our body works that way that it's starting to find like a deter, so to say, or finding an alternative compensation ways to get to the brain. Reflexes can present differently. So they can emerge, simply not emerge at all, or they can become pathological, can become dysfunctional. But if it's no severe neurological impact, then they will emerge, mature, and can be just a little bit still present with not so much problems, so to say. So those are easier. Sometimes we work on reflexes and in 2 months we can help child to integrate. But in many cases, not many, but if it's for example, cerebral palsy or brain damage, when it's severe damage, then it's really hard to rebuild this pathway. It takes us years to do that.
Okay, I understand. So, and tell me, what's that method, the MNRI method? The first time I saw it, like you just touched Michael and did like a little bit massage and moved his hands, moved his legs. I was very surprised that those actions will help him to do better in life, to overcome his difficulties, his emotional outbursts, his behavioral issues, his maybe focus and attention issues. Because you promised me that it will be better. Maybe it won't be 100% solution for everything, but for sure we'll see difference with time.
Yes.
Can you explain how the magic works?
MNRI method is Mozgotova neurosensory motor reflex integration. Dr. Mozgotova, Svetlana Mozgotova, she has PhD in psychology and 40 years of experience in this field, how she developed the method. And it's a simple but specific restorative techniques to help neurosensory motor dysfunction. So the method is simple exercises and specific body work techniques to help those reflexes integrate. So how it works? We know that when the child born, if we touch or put something into child hand is going to automatically grasp. So this is a hand grasp. So this is a stimulation and this is a motor response. So based on this knowledge, Dr. Mozgotova thought of, what if we're going to use this whole reflex pattern by helping those children who cannot grasp properly? And so basically, this is the simple exercise, how it looks. We're going to put the fingers, we're going to stimulate the reflex in the beginning of our program. That's how we do it, simply. Then we're going to modify to make body into different situations and different variants of the reflex. But that's how it's simple. It's a simple and profound. You just stimulate reflex and look for motor response. So I look at this method like very simple, is we're helping to build the pathways that didn't develop properly or that have this jitters. So we're helping the brain to build the proper pathway, and we help the nervous system to mature. It is the truth that this work requires discipline. Thanks to you that you've been very disciplined about it, repetition and intensity. So that's
dedication from parents.
Yes, dedication from parents. Because if you want to have a six-pack, you're not gonna go to the gym one time. You have to do balanced meals and have to go routinely and do this. So until we see the improvement and in many cases complete recovery for general function that we're looking for, we have to keep going with reflex and modify and make it so there is a stages for integration. In the beginning, we just stimulate, but then more and more we incorporate more density, so to say, and intensity into the program.
So in one sentence, if I understand correctly, body stimulation affects brain and build new pathways, missing pathways.
Yes, stimulation and motor response. We want to see if we stimulate what happens. We want to see, it's two most important to have.
Mm-hmm. And it's a lot of work. So kids, do they cooperate with you? Like always cooperate, or they against you every single time?
Well, of course, we have different children, and everyone stands the tactile stimulation differently. So not all cooperate. If you look at MNRI method and their intensive conferences that they do, you see that the children are staying on a massage table for a longer time to get the treatment. So sometimes it's a complicated process for children that are not ready. So when I see that the child is not ready to receive body work, the child cannot stay 1 hour on the table or cannot participate for 45 minutes on the table, that is a big sign for me that the child is not ready for real body work yet. And I will prepare the body with the programs and techniques that Dr. Mozgotova developed, which is tactile integration protocol. It helps them to prepare and calm their system down, their fight and flight system down. But I do follow the children and I love their creativity. Many times they want to be heard and I listen to them. I allow them to play. I try to play if it's possible during treatment, but I also allow parents to join and, we do teamwork, so to say.
Okay, and first time when child comes to you for evaluation, how do you test child and make a plan for like 6 months or 3 months program? What the program is this?
MNRI assessment is based on the reflex definition. So reflex is the automatic response of the nervous system for a specific stimulus. So to test the reflexes, I will test reflexes by providing stimulus. It can be different stimulus, tactile, proprioceptive, vestibular, visual, and auditory stimulus. Then when I apply those stimulus, I watch for the results. Am I seeing a proper motor response? Going back to hand grasp, if I'm going to put the hand and I'm going to ask a child to squeeze my hand, I'm going to see, is this age appropriate, right? If the child is 4 years old, what is appropriate grasp, the strength? I'm also looking for the pattern. For example, some children might do this. This is a proper response. And some children might do this. This is improper response. So we're looking for pattern, direction, timing, symmetry. One hand can do this, one can do this. Intensity, are they too weak or they are hyper? Some children grab you like this and they don't let you go forever. So as a result, I know I'm like, oh, okay, if the child doing this so hardly, how are they going to hold a pencil? Those children make holes into the paper when they do the fine motor tasks. So we go through each reflex and look for all those parameters. And then after I have an idea how each reflex integrated, at which state they integrated, if it's active, not active, if it's present, not present, pathological, dysfunctional, sometimes I will stimulate reflex and I will see completely different reflex. That means it's mixed in the brain, the reflex is mixed. So based on all those results that I found, and I talk to a parent and I see what's the main goal of a parent, and then we do the treatment plan, and then we start the integration process from there.
Interesting. During sessions with Michael, I noticed that you try to put some other exercises in plan, like to work on his balance, to work on visual tracking. Do you use them all the time with all the kids? You just it's a new techniques that you found them, or it's also the part of MNRI method?
I use balance, auditory, visual exercises. I use proprioceptive and cognitive exercises. I use neurofeedback and interactive metronome. I use auditory listening system and neurosolution laser that is very famous now.
I remember that laser. And sensory, right? You had some like a plane that looked like an airplane that was vibrating. What was it?
That was the Resimax. That's just the vibration tool that goes on the different frequencies to help children with the vagal nerve stimulation or the sensory issues, and to stimulate reflexes through a vibration. So I do my best to co-activate the brain. I do also believe for the brain hemisphere approach. So it's right and left brain hemisphere, and if they don't communicate properly, so our left brain involved in logic, language, analytical thinking. Right brain is related to emotional, imagination, creativity. So I use a lot of cross-lateral patterns to stimulate that communication, and I use Infinity 8 a lot, and I use a body exercise to do that. So, and then I co-activate the brain with all these techniques and tools to do a whole body integration, in addition with reflexes. So I do reflexes, I do right and left brain approach, and co-activation. So I want to see how much that nervous system can take from the child, how much, because if we don't push it, and it's not for everyone. The child must be ready and develop at that level. Of course, I work with children that are near drowning children. For them, sometimes it may be too much input, but I manage it, and I use my clinical skills and stimulate children with all the techniques that I can find to help them grow and learn.
Thank you. And one of the last questions, what do you recommend to parents? To wait and see, like to give some time to their kids to meet milestones, or to bring them as early as they can? If they know for sure the baby was born premature, so to start as early as they can, like 6 months old, or to wait until they see some delays. What is the best? Early is the best, or to wait and see? To relax and see?
Fortunately and unfortunately, our parent heart and mother heart gives us intuitive stimulus that if something is wrong, I should go and I should ask for help, and I should do something to help the baby. So I even saw in numbers that today, 95% of babies born will benefit from early intervention. And early intervention is can be done as soon as possible, and we should not wait to catch up. we should not wait to catch up with that. We should do not even till after 3. We should bring them as soon as possible in the first 6 months, because that's when the primitive reflexes are developed and emerge. So baby is integrating primitive reflexes in the first 6 months of life. And those primitive reflexes are the foundations and the base for all higher functioning. So if our child is not crawling, that's not normal. If our child is not creeping, it's not normal. If a child is not rolling, it's not normal. We should do something about it. We should go and look for a specialist. Reflexes help us with all this to catch up, to improve. If we're not going to do early intervention, that might delay and child already is going to create compensation strategies. So if it's not this deter that the brain is going to look for, it's going to happen. But if we're going to catch the child, baby, doing something improper early, we can rewire the brain. And when the baby is born, the neuroplasticity is like, it's so much easier and faster. So yeah, for many times it will happen that they will find the compensation techniques. They will slow down their processing speed, their development. Then we can see all this emotional parts of the behavior and delays. So during the first 6 months, we need to help baby to build a strong foundation. So I'm always for early intervention.
Thank you, Anastasia. I know that you see patients locally here in Florida, and for other parents around the world, if they want to connect with you to ask questions privately, how can they reach you?
Yes.
Do you provide telehealth?
Yes, I am on telehealth. I am on Zoom. I do consultation. I do home programs for children. I assist. I provide video lessons. You can reach out to me with my email on my website at wholesometherapiecenter.com. I'll provide the information for you so you can share.
Yeah, for sure. I will put information down below in the description. And yes, please contact Anastasia. She's a great specialist. She helped my son a lot, and she equipped me with so much knowledge for years to come. Thank you very much, Anastasia. Thank you for a great interview.
Thank you so much, Elizaveta. Thank you.
Bye-bye.
Bye-bye.